so when we finish, we'll just keep the recording on the Teams thing, on the Teams, and what we'll do with that is just you and I can have access to it. Now, I won't do much editing or anything like that because I'm just not very technical in that respect. So it's kind of co-owned by both of us.
Yeah, absolutely fine with me. We've just started recording now too. It looks like it couldn't start the transcription anyway, so I don't have to turn that off. So that's okay. But I can see on my screen there's a red dot in the top left, and I have the option to stop recording. Yes. But it did come up with an error message saying unable to stop recording and transcript. So I'm hoping this is working and it's going to save. So I might test it by turning off the recording, see if that saves a little video, and then start again. I wouldn't want to do it all and then it doesn't work.
My computer is saying that you started recording, and I can see a little red button on, although there's no timing on it. So
I have timing. So we've been together 14 minutes now. It's been recording for a minute and a bit.
Okay.
So
well,
it looks
that's
legit.
fine.
Then I won't restart it. So
if you've got it,
over to you.
All right. Okay. So, Olly, as you know, my name's Amelia Lyons. I lead the clinical supervision program at Newport in St. Cadoc's Hospital for Aneurin Bevan University Health Trust. And I'm doing a series of conversations and interviews with people on diversity issues. And you have kindly agreed, as a key member of our primary care team, to talk about the issue of sexual orientation with me. Okay. So if we can just illustrate that by the first slide there.
Absolutely.
And so each time as we go through our conversation and interview, we'll sort of just switch into the heading on and off for a bit. And talk about it. So what I'd like to do is I'd say that you're under 30 just. Are you still under 30?
I am. 3 more months and then I'll hit 30.
Yeah, and I'm just over 60. I'm 61 in a couple of weeks, actually. And I think that's quite interesting, that age difference between us, because we've sort of got a generation of difference. So I hope that might sort of help people from sort of my generation to understand people from your generation and younger. I don't know whether it will do or not.
I hope so.
But yeah. And so tell me a bit about you, though, before we start. You can, again, sort of just switch that off for a minute, and we'll just be...
I feel like I can begin anywhere, but I'll be focused, what my brain can be like. So I've worked for the Aneurin Bevan Trust for coming up to 7 years now, including a year on the bank. Formally, it's been 6 years according to my employment, but I've been here a little bit longer than the contracts I've been working. And through that time, I started working in sexual and reproductive health, specifically in an outreach service, providing therapy and outreach support for those who are struggling with some parts of the job were safeguarding focused. So it was around exploited young people who are in harm's way or being abused in some capacity sexually, and providing outreach work for that. And as part of that, I did develop a specialist clinic working for young people, providing them counselling and therapy around their dysphoria connected to feelings of gender or their sexual orientation, or any difficulty that would kind of linked to their sexual health and their overall well-being, which was...
Let's just explain that term. So dysphoria, because that's kind of, tell me, what do you understand by that term?
So dysphoria, in its wider definition, by definition, it's a feeling where something doesn't quite match up with our expectation of how it should feel. So, for example, you'd be euphoric as opposed to dysphoric. I think people, especially in nowadays, there's been a program that was out last year called Euphoria, and it's very popular with young people, and it's all about teenage life and sex and everything like that. So people are more familiar with euphoria. So dysphoria being the opposite of that. It's things that feel incorrect. It doesn't quite fit us. So in kind of and I suppose a therapeutic field, if you think about dysphoria as a kind of pathology, so like a bad thing that someone is experiencing, it usually causes emotional distress. So in this context, It'll be about how we are assigned a specific assumed gender at birth. For example, I present quite male looking, and people could assume that I identify as male, but I may not feel that way inside, and that would be dysphoric. And it's about the connection of living day to day as the person that we are assumed to be, where we may not identify in that way ourselves. It usually leads to kind of develop coping behaviors of kind of placating others, fawning others, and providing for their needs over our own needs, not wanting to stand out too much, not wanting to be seen or be judged or criticized. It's usually kind of bundled up with a kind of shame-based presentation. You're ashamed of yourself, self-critical, judging yourself, scared of what people might say about you. Those kind of.
So let's come back to that in a minute then. Just sort of finishing off. Thank you, Olly. Though I think that there's dysphoric, isn't there? That kind of unhappiness, and a kind of dissonance, which is, I think, what you're also saying there, a kind of mismatch sometimes between the outer and the inner, and that's a good way of putting it. And we can come back to that in shortly. Just sort of perhaps saying a little bit about your role now in the health board, and
And I'll also share a little bit about myself personally too, outside of my work. So in the work, what I do now is after working sexual health, I joined primary care as a counsellor, which I will share with you in this. I'm just very mindful it's recorded. I've not shared this with anyone before, and
we have got control. So
that's
if we need to,
I appreciate that. I'm happy to share. I made the decision to, because nothing, it's not incriminating anyway, really. It's just I've never said it to anyone before, which is I was hired working for primary care as a counsellor back in, I was maybe a year post-grad. And I was fairly young, I suppose my point. I was 24 at the time, and to be a counsellor or a therapist at that age it's quite rare, I suppose. And people were skeptical if I could do the I think. So I had 2 interviews actually for a role as a counsellor, which I welcomed the diligence in that. And interestingly, a successful interview, got the job, was hired. I've been doing therapeutic roles in sexual health and fit the bill. And then there's an interesting phenomenon where I would get kind of questioned because of my age. This isn't about sexual orientation or gender presentation, but this is about diversity and inclusivity.
Yes.
Because of my age, I had queries of my capability. Like, are you sure you can do this? Do you know what that means? And do you know what difficulties are for people? These kind of questions, which is very ignorant because I've been through a significant amount of hardship, I think, in my earlier life. Which is connected more so to sexual orientation and gender identity things. But then I got told once on a staff night out, so a bit of intoxication all around, I think. Somebody said to me, "Oh, you're lucky that we hired you. We hired you because we needed you for the diversity card." And I was guffawed, to say the least. I think in the moment I was so taken aback.
Open-mouthed.
They meant it as a compliment, which was even more interesting. It was like, we didn't know if you could do it. We just hired you on a diversity card, but you actually proven you can do this job too. And that was an uncomfortable kind of rite of initiation or something, or like a recognition of my capabilities from the cisgendered, heteronormative, kind of more bigoted and ignorant worldview. It's almost as like they were saying to me, you're okay for a gay person or a young gay man that doesn't quite usually work here, but look, you fit in. And it was really odd that they thought they were doing me justice by congratulating me, and I'd proven their bias wrong. And I found that really uncomfortable. But I digress, because I'm sure we will get into that a bit later, talking about experiences of bias. But you do look like you've got something you want to ask.
Well, no, that doesn't feel like a compliment to me, is all I was going to say. That absolutely doesn't feel like a compliment to me. It's almost like you only got this because of the diversity card, whereas actually you're very well qualified and you'd already had, because I sort of encountered you on the program, an in-depth experience in counselling, in the
Oh
work
yeah, I
that
forgot
you
that
did.
coincides when you and I had met. We'd met prior to me,
Mm.
to
Yeah,
joining primary care, didn't we? So
yeah,
you'd had quite a significant input in my training in clinical supervision. So I'm glad to know that you could see what I was about, and
yeah,
thank you.
yeah,
I agree. It wasn't very complimentary. But I digress. I stayed with them, with
yeah.
primary care, that is, working as a therapist. Didn't
Mm.
have the opportunity to specialise in delivering gender-specific therapy, unfortunately, but I did find the nuggets of client work, and within that, kind of developed myself in some capacity as being acknowledged as that being a strong point of mine, or like a
Mm.
specialism within my psychotherapy. Not
Mm.
just gender, but shame-based presentations and a sense of identity, and what it means to be us, in a
Yeah,
world that doesn't quite fit who we
yeah.
think we are. Um, and then I've moved to work for the PHP service as a clinical supervisor and the one of the managers, I suppose, in more of a managerial role, but also supervising the clinical work provided by the team of staff that I have.
So you're now a manager and a clinical supervisor of
Yeah.
counsellors, and you're still under 30. Just to acknowledge the
Yeah,
achievement
thank
of
you.
that, I just
Yeah,
want to, yeah, yeah.
yeah. Which is, ironically, I do talk to that colleague still who gave me the backhanded compliment around my capabilities and proving them wrong. And I speak with them now in a supervisionary kind of relationship where I am kind of giving them advice about their clinical work. And as you can see, I'm smiling. A part of my ego does enjoy that, the smugness that comes from that. But personally, I identify as a non-binary, so my gender identity is
Yeah.
non-binary. I know that I present as male, so I've got like facial hair, I have short
Mhm.
hair, I
Mhm.
wear, not always, I wear for work mostly, stereotypically associated male clothing, but sometimes I don't. I got like dangly earrings in, I think today. I don't really think
Mhm.
about it, just whatever it
Mhm.
feels
Yeah.
like representative of me and how I want to dress. Some days that could be going out in, I don't know, a crop top and shorts in the summer when it's not freezing like it is today. Um, and some days that could be going out wearing makeup and a wig and a full outfit. That's a more feminine outfit, or stereotypically a woman's clothing. It could be going out wearing heels but wearing men's clothing. It's very like, a blended. It's not so
Yeah.
binary in the gender. I'm not like I don't present 100% as a man or 100% as a female. And that's outward looking. And I think in my personality and who I am, I think I embody that. Also, I can be sensitive and effeminate, and I can be stoic and stereotypically manly, if I needed to be. I can do DIY. I can also, paint a whole face of makeup really well, So that's kind of a personal identity in my gender. And
So I have the sort of image there of,
mm,
a piano being able to play a wide repertoire right along all of the
yeah,
keys, actually, Yeah.
it's interesting. I say to people, it's more so in therapy and not in a way of preaching my ideals onto people, like
Mm.
disclaimer here. I'm not saying they need to believe me. But I do share kind of a personal worldview of mine, but when it's appropriate with clients, um, usually to challenge a kind of negative perception they may have about themselves and the worldview. And when they're usually comparing themselves, so in this scenario, they're usually gender queer, which I'll explain what that means shortly.
Yes.
Individuals who would be trying to exist in a heteronormative, say like straight people
Yeah.
world, who
Yeah.
with people who are assumed cisgender, say like the gender you were born as, so I
Hmm.
would assumed to be a man.
Yeah.
Um, and they usually these clients usually you do a understandable like social comparison to them and others that they assume are similar, and they want to like blend in and not be seen and minimize themselves. And your analogy of the piano fits in really well with this. And what I say to people is, I do have a level of sympathy for people who are cisgendered and heterosexual with who haven't had the opportunity to look inwards and get to know the multifaceted aspects of their personality and who they are and what they're about. It can be a comfortable life if we are assigned a box to fit in, and then if you fit in the box, why would you rock the boat? But then you may get a very limited experience. So you may not get to see all of the keys on the piano. You might get
Hmm.
to just, see in a
Just
certain eighth of that.
play a narrow range. Yeah.
Exactly. narrowing the experiences that we have, not just with ourselves, but with others. Oh, I think your internet may have gone a bit slow. It's okay if we...
I'm still here. Can you hear me?
Again,
Can you hear me?
it's very broken. It's coming through a bit robotic and sorry, and broken on your end. So I can stop the recording, and then if you wanted to come back, we can start it again, or I can keep it running. That's absolutely fine.
Stop the recording.
Mhm.
Let